Are hospitals switching to reusable scrub caps? The answer is yes, for a number of reasons. Firstly, obviously the NHS has a commitment to be net zero, and so disposable hats are incredibly wasteful compared to reusable hats. And for a myriad of other factors, disposables have a lot of problems of actually being able to track the inventory of them. They obviously know how many they buy, but they don't really know when they end up. Do people accidentally pick up two? Do some rip? Do they not fit that very well? Whereas with reusables, because there's a lot more thought into the sizes and styles, and especially if you're getting kind of names and roles added on them, then there's more of a kind of inventory check and scrutiny, and rightly so, because the whole point of it is to save CO2 and also to cut your costs, more importantly, which is actually the biggest factor for why they're changing. Obviously, at some point, they will all have to change because, again, you're trying to get as much CO2 out of the way or not in the system at all. But the cost saving, when you think about, typically we see around a year for a return on investment, and with the hats lasting 3, 4, 5, 7 years, obviously that can then lead to kind of substantial savings, even just in this small narrow window of disposable scrub caps. If you think of all of healthcare, I think it's something like, is it 2%, 3%? I don't want to quote it, but have a look at the figures for how much they think healthcare in general contributes to CO2. It's obviously quite a lot. So we're doing our bit at Medicus Scrub Caps, and so that's why we bespoke the implementation based on what your hospital needs, or even just your team, or even just yourself needs. No minimum order quantities, just lots of savings to be had the more you order, as well as VAT exemption, which I can share in another video. Otherwise, hit me up in the DMs.